Welcome to another episode of What is Hashimoto's with Dr. Martin Rutherford. To find out more on any of our topics, or for information on scheduling a consultation with Dr. Rutherford, please visit us at whatishashimotos.com. And now, here's Dr. Rutherford.
Hard to regulate thyroid medication with Hashimoto's. There's so many aspects to this, but let's just stick to why is it so hard to regulate thyroid medication with Hashimoto's. So first of all, I get a lot of people coming here like, no thyroid medication. So I mean, if you're not taking thyroid medication, I might try to work on that with those goals. That's not my goal. My goal is to get you as close to remission or into remission if possible. And if thyroid medication can be an asset in that, which it can, then I'm all for it. But it's gotten a bad reputation because I have a lot of people come in here and I'm taking the thyroid medication, I'm feeling better, I feel worse, it blew my head off. So that's what we're going to talk about. So if you have Hashimoto's, it really is a good thing if you can find a doctor. That's a big if at this point in time. If you can find a doctor or an endocrinologist who understands the whole spectrum of Hashimoto's, but if they simply understood that that certain thyroid medications are not good for Hashimoto's patients. Which one is it? It depends on the patient. In general, one of the worst ones is Synthroid. I've had 2 people on Synthroid, which is disappearing, it seems like. And I think it's disappearing because I think the insurance companies are paying more for levothyroxine. But Synthroid has like 8 different potential triggers in it for Hashimoto's. And 2 of the biggest ones are gluten. Yes, Synthroid has gluten in it, and food coloring. And there's like 6 other ones that are all, you can take it, all of a sudden you go, I took it, and all of a sudden I started getting heart palpitations and anxiety and fatigue and brain fog, and my doctor said it couldn't be from the medication, and it is. So to give you that's just one kind of generalized example of some of the uniqueness of a medication. Most of the synthetic medications only have one hormone in them. It's called T4. For those of you who haven't been watching any of my stuff over the last, how many years, T4 is an inactive hormone made in the thyroid, meaning it doesn't do anything until it gets somewhere. It's got to get to the liver, it's got to get to the stomach, it's got to get to your cell sites, and then there are enzymes that cause it to turn into something called T3 and make it active. So we need T4 and we need T3. So some people do well with T4. Some people take T4 and they go like, it hasn't made any difference in my thyroid, my TSH is normal, my TSH is high in T, so I don't feel a difference. That person probably has what's called a conversion problem. They're probably just not changing the T4 in that synthetic to active hormones in the places I just got done saying. Liver, stomach, and cell sites. So that person probably would do well with a little T3. Okay, T3 is the active hormone. Now, trying to get your doctor to give you T3 is like pulling teeth. There are doctors that are starting to do it now. I know the medical societies have said over the last year and a half that it's okay to give a person a little T3. In fairness to the doctors, they've been told not to do it, and the doctors, they're under the impression that you're going to take T3 and all of a sudden your heart's going to start pounding and so on and so forth. So if they understood what I said about the conversion, which I must know none that do, and I'm talking regular medical doctors, not the alternative medical doctors. The alternative medical doctors, their holy grail is T3. They want to give you T3, and that may be fine for you. Okay. So T3 is the active stuff, so you're taking T4, nothing's happening, maybe you need T3. Well, where do you get T3? You can either get it separately, synthetically made, or you can get it by taking the pig glandular stuff or the cow glandular stuff, the things that are in the natural thyroid hormones. Now, natural thyroid, good, synthetic, bad, wrong, okay? So you can take natural thyroid, and if you already have enough T3 running around your system and your thyroid stimulating hormone is normal, despite the fact that you have Hashimoto's, you can take T3 and it'll blow your brains out. because you don't need the extra T3, and it'll make you jittery, and you'll get like anxiety and panic attacks and insomnia and all that type of stuff. Start breathing, chest pain, all the whole thing. So synthetics T4 in general. Then you have the bioidenticals. The natural has T4 and T3. So the bioidenticals have the T3 that will actually make you have a response. For some people, that's good. For some people, that's bad. I personally, I've had Hashimoto's for a long time. I currently am on 25 micrograms of levothyroxine, which is like a tiny dose. And I'm on 15 micrograms of something called liothyronine, which is T3. Now, it's been hard for me to get the doctor that I need to go to, because I'm not a medical doctor, to do this. I used to have a couple of alternative practitioners here that were naturopaths or osteopaths, sorry, and I could get it. But now they've moved on, and I can't, and it's hard for me to get. So I finally found a doctor that's helping. But it was like pulling teeth. So I don't know how you do it if you need it. Okay, but the bottom line, I think, and I can go on and on and on. There's one called tyrosine that's just T4. But the nice thing about tyrosine is it's the polar opposite of Synthroid, where there's nothing in there that's going to trigger you. Everything that could possibly create an immune response has been taken out of it. It's a liquid. It's assimilated really well, and so that's a nice one for a lot of people, especially if you have multiple chemical sensitivities and you're sensitive to smells and allergies and all that type of stuff. Sensitive to perfumes and those softeners that they put in the dryers when you're washing your clothes and all that type of stuff. Tyrosine's probably a good thing for you. So as you can see, it's kind of a prerequisite. It should be a prerequisite if you're a doctor to kind of be conversant with all of these aspects of it. But then they would have to have kind of like the functional understanding of, wow, maybe this person's thyroid is working fine. Maybe the attack on it is not bad. Maybe the immune reactivity of the thyroid is low, because you could have high immune reactivity or low immune reactivity with your Hashimoto's. You could have an aggressive Hashimoto's, a mild Hashimoto's, depending on how much damage you've had to it over the years. I mean, it's a spectrum that is crazy wide, but you have to figure that out if you're going. So most people either luck out or don't luck out. It's like, he gave me liothyroxine. Now, why do people give you levothyroxine most? Because that's what the insurances pay for. And I'm not sure all the insurances. There was this one, and I just talked to somebody yesterday who was taking it. That there's this one medication called Thyroid, and I had a lot of patients who were doing very well on that, and all of a sudden nobody could get it. And so I'm not quite sure why she's got it, and I didn't ask her. But then that was the disaster, because as you can see, there are a lot of parameters as to why she was working well with that. There was no ingredients in there that made her sick. She probably has low thyroid, what's called free T3. She probably has that low. She's probably not converting probably. She needed T3. She takes the T3, and within 3 days, she felt much better. Makes my job way easier if a person comes in here with a normal TSH, thyroid stimulating hormone, the one number that everybody takes in the medical field, and if their lab ranges are around 1 to 3, somewhere in there, which is where we in functional medicine, who've done thyroid for a long time, consider a normal range. It makes it way easier, because now you got some energy in your system. Maybe your bowels are moving better than they would, because if you got hypothyroidism and your bowels move slow, maybe you're making better hydrochloric acid in your stomach, because if you don't have enough thyroid, you're not. Maybe your polycystic ovarian syndrome gets less, because that's connected to. I mean, I could go over 100 things that could be at least improved, despite the fact that you might have 39 other different things that need to be addressed, or 5 other things that need to be addressed would probably be more accurate. It would be helpful. It would be helpful. So thyroid hormone is good when it's the right hormone, when it's the right medication, at the right dose, and get you out of hypothyroidism. Any other time, it's kind of like causing you a problem. So I mean, and I hope that also clears up I never want to take thyroid hormone. versus the synthetic versus natural, and this one's better than that one. If I were a medical doctor, it'd just be trial and error. If I gave him one thing, I mean, if I didn't know any of this, I would give him one. I had a lady the other day, and she has thyroid medications to make her feel better, but the TSH wasn't normal, so they changed it, and now she's got all these hyperactive symptoms. So a second good way to figure it out is I took it and it made me feel better. Keep taking it, but they're hooked on the numbers. There's a lot of legal issues that they have to follow through. They don't want you having a problem and then you going somewhere and an attorney going, oh my God, he gave you this medication and he just kept giving it to her because she felt well. Maybe you're the 1 in 1,000 people who has a problem with it, and then boom, this guy's in trouble. So these are the realities you're dealing with as far as when you're going to the doctor. These doctors are not dumb. These are smart people. I've never found one that was not bright. But you have to understand they're educated in a certain model, almost in a vacuum. That it's with the advent of 15 or 20 years of Hashimoto's data coming out. The medical profession's starting to break a little bit on that, but it's so slow, and I don't know what it's going to take for your doctors across the board. Now you have nurse practitioners, you have medical doctors, you have PCPs, you have endocrinologists, you have all these people doing your thyroid. Chances of them all knowing this is like 0 and none. So and then you're going to be sent there by the insurance company. So this is your challenge. You have to somehow educate yourself at least a little bit. This is a good, believe me, I could go on for hours on this one subject, but this is like a good kind of framework for you to look at a couple of times before you go to your medical doctor to try to ask a couple of questions. If you are watching this because you're going, my medication isn't working. I'm taking the medication, it's not doing anything. Or I'm taking the medication and my TSH is normal, then it's making me worse. And the doctor's telling me I got to keep taking it. And if you're in any of those things, it's just a matter of you got to get your doctor to go, look, we got to change to something. Even if they do trial and error, for God's sakes, until we find one that actually makes you feel well and your numbers start moving towards normal, that's really the best thing to do if you don't really understand all of this stuff. So it's a big challenge. It's a big challenge. If somebody comes in here and I'd like to see them get on some medication and TSH, that's what's in my mind. I'm thinking like, where do I send them? What do we do? If they have a nurse practitioner who's like moving in this direction, sometimes I can talk to them and it's kind of fun. But I'm not a medical doctor, so I can't prescribe any of this stuff. I can only tell them what I've seen relative to responses of care based on what they've done, and that's kind of where that's at. So that's thyroid medication, and why it's so hard to figure out your thyroid medication, and it's kind of like, again, I always use the term glyph notes, but that's really kind of a good framework for you to understand as to why your medication may or may not be working, why you may have a synthetic that's doing great and your neighbor may have a natural that's killing her, and so on and so forth. So I think it's a good topic, and so I think I'll wrap it up with that. And until next time, yeah.
Thank you for joining us for another episode of What is Hashimoto's? To find out more on any of our topics, or for information on scheduling a consultation with Dr. Rutherford, please visit us at whatishashimotos.com.